Welcome to the deep dive. This time we're going deep on cancer and its symptoms. We've got info from the NHS, UCSF Health, Mayo Clinic,
WebMD,
oh yeah, WebMD, Cancer Research UK,
a National Cancer Institute.
right, and the Cleveland Clinic
Yeah.
to give you a solid understanding of this complex issue. Before we get started, be sure to like, share, and subscribe to Visions Beyond. Leave a comment with suggestions for future deep dives.
It's great to be here. Cancer's huge, but our mission today is to equip you with knowledge, not fear. This isn't a replacement for professional medical advice, but a starting point for, being proactive about your health. Ready to learn more about what your body might be telling you.
Absolutely. I think a lot of us have questions about cancer but don't know where to start. So let's get back to basics. What is cancer?
Basically, cancer is uncontrolled cell growth. These cells, they just start multiplying rapidly, invading and destroying
Sorry.
surrounding tissues, and this growth can spread to other parts of the body. That's called metastasis.
So it's like a cellular rebellion, right?
Yeah.
Breaking all the rules.
Yeah. Yeah, that's a great way to put it. Because of this unpredictable behavior, cancer is a serious health concern. The World Health Organization, they say it's the second leading cause of death globally.
That's a sobering statistic. And the Cleveland Clinic, 1 in 4 people will develop cancer in their lifetime.
Right.
Really drives home how important this is.
And here's the thing. Cancer often doesn't cause pain early on. The National Cancer Institute, they point out that pain is often not an early symptom.
That's a bit unnerving. So what should we be looking out for?
The NHS advises seeing your doctor if you have any unexplained bleeding, blood in your urine, stool, bleeding between periods or after menopause, or rectal bleeding.
Those are definite red flags. What about moles? What changes should we be watching for?
UCSF Health uses a great acronym, ABCD. It stands for asymmetry, border, color, diameter, and evolving.
Okay, I can remember that. So asymmetry would mean the mole looks different on one side.
Exactly. An irregular or blurred border is also a warning sign. And of course, any color changes, different shades within the mole, or an overall darkening or lightening.
Got it. What about diameter? How big is too big?
Generally, if a mole's bigger than a pencil eraser, get it checked out. And finally, evolving means any noticeable change in the growth, shape, color, or if it starts to itch, crust, flake, or bleed. Any of these changes, and you should see your doctor.
So it's not just noticing a mole, but any changes in a mole. This is really practical advice we can all use.
Absolutely. Early detection is crucial for skin cancer because it's often very treatable when caught early.
Now, what if you find a lump?
The NHS is clear. Any lump in your breast or any lump that's increasing in size, it should be checked by a doctor.
Okay, any lump that's concerning you, go to the doctor. Speaking of lumps, let's talk about breast cancer. We hear a lot about lumps, but are there other signs?
Definitely. Many sources point to changes beyond just a lump. For example, skin dimpling, kind of like an orange peel appearance.
I've never heard of that. Is it actually visible?
It can be. Nipple changes like inversion where it turns inward or discharge, especially if it's bloody. Be familiar with your own breasts and report any unusual changes.
This is eye-opening. I think a lot of people focus on lumps, but there's more to pay attention to.
Yeah.
Okay, let's talk about changes in our business.
Right. To put it delicately, pay attention to your bowel and bladder habits.
Like going more or less than usual.
Exactly. Also, changes in your urine or stool, including blood or any pain during these processes, mention it to your doctor.
Those sound like pretty clear warning signs.
They can be. And they're highlighted across multiple sources. The NHS, they specifically advise seeing a doctor if you've had changes in bowel habits for 3 weeks or more.
So that 3-week rule is a good guideline. If something's been off that long, check it out.
Yeah, and this applies to a range of symptoms, not just bowel changes.
Such as?
A cough that lingers for 3 weeks or more, persistent bloating for the same time, and unexplained weight loss over a couple of months.
Weight loss. I thought losing weight was a good thing.
It can be, but not always. Unexplained weight loss with cancer is often a sign that something is wrong. The Mayo Clinic explains that cancer can kind of steal nutrients from normal cells, leading to weight loss even if your eating habits haven't changed.
Wow. That's chilling. So we've covered bleeding, lumps, skin changes, bowel and bladder changes, and weight loss. What other symptoms?
Fatigue is a big one. We all get tired, but fatigue related to cancer is different.
How so? What makes it different?
It's persistent, overwhelming tiredness. Doesn't go away with rest. UCSF Health mentions that leukemia, for instance, can cause this.
So if you're feeling drained all the time, even after sleep, that's a red flag.
It could be. Of course, there are many causes of fatigue, but ruling out cancer is important.
Makes sense. We talked about the physical signs of cancer, but what about the emotional and mental aspects? Can those be affected?
Absolutely. Cancer can impact us on many levels. UCSF Health points to persistent, unexplained headaches as a potential sign.
Headaches. Really?
Yes. We're talking about headaches that don't respond to the usual things and have no obvious cause. They could indicate something more serious.
Okay, I'm adding unexplained headache to my list of things to watch for. It's amazing how many potential symptoms there are. So we've covered a lot, but it's not all doom and gloom, right? There must be things we can do to lower our risk.
You're right. There's power in prevention.
So what can we do to tilt the odds in our favor?
Well, multiple sources emphasize lifestyle choices. Not smoking is huge.
I think we all know that smoking's bad, but it's worth repeating.
It really is. Smoking is linked to many cancers, not just lung cancer.
So ditch the cigarettes. What else?
Moderation with alcohol. While an occasional glass of wine is fine, excessive alcohol increases the risk.
Moderation is key.
Absolutely. And let's not forget about a healthy diet.
Bring on the fruits and veggies.
Exactly. A diet rich in those and whole grains is associated with a lower cancer risk.
So that means cutting back on processed foods and sugary drinks, right?
That's right.
Okay. Healthy diet, moderate alcohol, no smoking. What else?
Regular exercise is another tool in our arsenal. Activity helps you maintain weight, boosts the immune system, and reduces the risk of cancer.
I'm lacing up my sneakers as we speak. What about sun protection?
That's essential too. The sun's UV rays can really damage our skin. Always wear sunscreen with an SPF of 30 or higher, even on cloudy days. Cover up with clothing and seek shade when the sun is strongest.
Sun protection year-round. We've covered so much. But before we move on, the goal here is to empower you, not scare you.
That's exactly right. We want you to feel informed and in control of your health.
Knowledge is power. The more we know about cancer, the better prepared we are.
Exactly. Early detection really increases the chances of successful treatment.
So talk to your doctor. They're your partners in this.
Absolutely. Regular checkups are essential.
Well said. This has been incredibly informative. Before we wrap up part 1, like, share, and subscribe to Visions Beyond. Leave a comment with suggestions for future deep dives. We'll continue this discussion in part 2.
Welcome back to the deep dive. Let's pick up where we left off. Explore the genetic aspects of cancer. You mentioned it's a genetic disease. I think we should unpack that a bit. There can be some confusion around what that means.
You're right. When people hear genetic, they think if someone in their family has had cancer, they'll get it too.
That's a common misconception. While some cancers are linked to inherited mutations, most are from acquired mutations.
Okay, so what's the difference?
Inherited mutations are the ones you're born with. Passed down, present in every cell of your body. Acquired mutations develop during your lifetime due to, exposure to carcinogens, lifestyle choices, or even random errors during DNA replication.
So even without a family history of cancer, you can still develop it.
Absolutely. The National Cancer Institute, they estimate that only about 5 to 10% of cancers are caused by inherited mutations.
That's reassuring. So aside from what we talked about before, what other lifestyle factors can increase the risk?
We discussed smoking, too much alcohol, and lack of activity, but diet is a big one too.
We touched on fruits and vegetables, but what about the flip side?
A diet high in processed foods, red meat, and sugary drinks can increase the risk of certain cancers.
So those late-night pizza binges might not be the best idea.
Probably not a regular habit. And while we're on things to be mindful of, let's revisit sun exposure.
Yeah, I love a sunny day as much as anyone, but we need to be smart.
Right. A little sunshine is good, but too much exposure to those UV rays can really up the risk of skin cancer.
Okay, sunscreen, hats, and shade it is. So we've talked about lowering our risk, but what happens if someone does develop cancer? What are the treatments?
That's a big one, and the answer really depends on the type of cancer, the stage, the person's health, and preferences.
So no one size fits all.
Nope. Cancer treatment is highly individualized. Often a whole team of people work together to make the best plan.
That makes sense. What are some common treatments?
Surgery is often the first line of defense, especially if the cancer is caught early. It involves removing the tumor, sometimes surrounding tissue too, to prevent spread.
It's like removing the weed before it takes over the garden.
Good analogy. And sometimes surgery is combined with other treatments like radiation or chemo.
What is radiation therapy?
Radiation therapy uses high-energy rays to kill those cancer cells. It can be delivered externally with a machine or internally, placing radioactive material near the tumor.
Sounds intense.
It can be, but it's often very effective. Then there's chemotherapy, which uses drugs to target and kill cancer cells.
Chemo has a scary reputation.
It does, and for good reason. Side effects like nausea, vomiting, hair loss, fatigue, and a weakened immune system can be tough.
That's rough.
It can be, but there are medications and therapies to help manage the side effects.
So it's not just enduring the treatment. There are ways to make it bearable.
Absolutely. The goal is not only to get rid of the cancer cells, but to help the patient's quality of life throughout treatment.
I'm glad to hear that. So we've got surgery, radiation, and chemo. Any other options?
Yes, there have been some great advancements, especially with immunotherapy.
Immunotherapy? I've heard that, but don't really know what it is.
It basically uses the body's own immune system to fight cancer.
Incredible. How does that work?
Different types, but one of the most promising involves what we call checkpoint inhibitors.
Checkpoint inhibitors. I'm not familiar.
Okay, so our immune system has these checkpoints. They prevent it from attacking healthy cells. Cancer cells can sometimes exploit these checkpoints to avoid detection. Checkpoint inhibitors are drugs that block these checkpoints so the immune system can target and destroy those cancer cells.
So it's like a power boost for the immune system.
That's it. Checkpoint inhibitors have been really successful in treating many types of cancer.
That's encouraging. It seems like treatment is getting more personalized.
It is. We're moving away from that one-size-fits-all and toward treatments tailored to the individual and their genetics.
That's fantastic. Gives me hope for the future of cancer treatment.
Me too. It's important to remember that even with a cancer diagnosis, it's not a death sentence. Survival rates have really improved thanks to advances in treatment and early detection.
That's powerful. So what can people do to ensure early detection?
Regular screenings are key.
Like mammograms for breast cancer and colonoscopies for colon cancer.
Right. These screenings can detect cancer early on when it's most treatable.
Don't skip those appointments, folks.
I can't emphasize that enough. Early detection makes a big difference.
This has been so informative. We've gone from the basics of cancer to cutting-edge treatments. But there's one more thing.
What's that?
The emotional and psychological impact. A cancer diagnosis can be devastating, not just for the patient, but for their loved ones as well.
You're right. We need to remember that cancer isn't just physical, it's emotional too. Patients go through a lot of feelings: fear, anxiety, sadness, anger.
And it's important to allow those feelings.
Absolutely. It's crucial for patients to feel those emotions and seek support.
Where can they find support?
Lots of resources are out there. Hospitals have support groups, counseling. There are online communities, organizations too, that offer support and information.
No one has to go through this alone.
Exactly. And don't forget self-care during treatment.
Right. We talked about lifestyle changes to lower risk, but those same changes can help during treatment.
Absolutely. Healthy diet, exercise, managing stress. These can all improve quality of life during treatment.
So caring for the whole person.
Precisely. And remember, there's always hope. Even with cancer, there's hope for healing, remission, and living a good life.
Beautiful message. This deep dive has been so informative. I hope our listeners are feeling more empowered.
Me too. Knowledge is power. The more we know, the better we can face this.
We talked about the causes, symptoms, and treatments. We also talked about prevention, early detection, and getting support.
And through it all, we've tried to stay hopeful.
Because even though cancer is serious, it's not unbeatable. We're learning more, and there are new treatments coming out all the time.
That's right.
So don't give up hope. Keep fighting, keep learning, and take care of yourselves. We'll continue after a short break.
Welcome back to the deep dive. As we wrap up, let's go back to prevention.
Yeah, it's so important. We can't control everything, but we can definitely lower our risk.
We talked about not smoking, healthy weight, moderating alcohol. But what about family history? Can we do anything about that risk?
If you have a family history of cancer, talk to your doctor about genetic testing and personalized screenings.
So tailored advice, not just general guidelines.
Right. Even without family history, it's good to be proactive.
Proactive, how?
Being aware of your body. Pay attention to any signals. Don't ignore changes.
So if something feels off, trust your gut.
Exactly. Always better to get checked out.
Which brings us back to checkups and screenings.
Absolutely. Screenings are so important for early detection.
So don't skip those appointments.
Seriously. And even if you are diagnosed with cancer, it's not the end. There's so much hope, new treatments all the time.
It's amazing how far we've come. It is. The future looks bright with research and new treatments.
This has been an amazing deep dive. I hope everyone listening feels empowered and informed.
Me too. We've learned so much about causes, symptoms, treatments,
We talked about prevention, early detection, and finding support.
and most importantly, we focused on hope and resilience.
Thanks for joining us. We hope you found this deep dive helpful.
Remember, knowledge is power. The more we know, the better equipped we are.
And before we go, don't forget to like, share, and subscribe to Visions Beyond. Leave a comment with suggestions for future deep dives.
We appreciate your support.
Until next time, stay curious, stay informed, and take care.
See you on the next deep dive.